Yes, you can now hear me well. Great, thank you, Andrew. Yeah, as I was saying that, in the last session, I listened carefully, and right from Benoit, right from Jojo, and all those who spoke, they mentioned the word professionalization almost 6 times. I noted that, maybe more, but when I was asleep, I missed it. When I was awake, I noted it down. So it just meant that this is a very important subject, and I'm glad that we have people who have worked actually on professionalization in the room. We have CLT here, and many more of you who are also going to share with us on professionalization. Without so much ado, I think you have seen all these faces since yesterday, but those who were not here yesterday, could I just say we take 1 second just to introduce our name and organization right from the end to introduce my panel?
Yes, my name's Rebecca Bailey, and I'm with Capacity Plus.
I am Taylor Wilkerson with LMI.
Musonda Kasonde with UNICEF.
I'm Bridget McHenry with USAID.
And I'm Pam Steele with PSA Associates and also Research Working Group Lead. So thank you all for being here. To start us off, I think we will go back to yesterday. For those who are not here, we had a fantastic time looking into the whole aspect of leadership, because we know we have so many health workforce. I think there's a presentation that cited on the numbers of workforce, health workforce that we have globally, and it's huge. So all those people need to be led. We had a very interesting topic yesterday on the whole notion of leadership. And Musonda and Bridget took us through that. I think we will start off with that today and get us back to, what next after knowing that leadership is key, move into professionalization. So I'll give the floor to Musonda. You can come up here. And yes. Okay. Minimize that. Right, okay.
Can I steal the clicker?
Yes, please, and I will make this broad. Make it that with you. So when I turn you, sorry, we will have to keep time as well, so feel free to do the best you can.
I will try to keep within the time, but not speak so fast you can't understand me. And I apologize because I've had a lot of caffeine, so that will be a challenge. Yesterday was an all-day workshop that was co-convened by Gavi, UNICEF, and USAID because we're all really interested in this issue of supply chain leadership and collaborating together to really support leadership for national supply chains. And the reason we're so interested, or the reasons we're so interested in leadership, is that we recognize that there is a changing environment for supply chains. There's a lot that's happening. There's new technologies. There's more and more complex supply chains and systems to work in, and complex models. And so there's this evolution of the needs of supply chains. And the kind of change it requires high-level champions. It's not that the supply chain workforce isn't a critical piece of this, but these kind of changes can only happen with that high-level championship and leadership. And the workforce, in order to be able to develop and really implement these changes, they need to be functioning in an enabling and empowered environment. And ultimately, we're really seeing in country after country this need to reposition the supply chain within the public health system and really elevate its visibility. So what we are trying to help support is national supply chain leaders and really leadership cohorts, collaborations of high-level leaders and champions with a future vision for their country supply chains, and want to help do that by helping instill and helping develop and supporting leadership and change management skills, developing support networks and peer-to-peer learning amongst countries. It's not that way. There was some discussion about this yesterday. It's not that there is a need for us as international donors and agencies to come in with a Western model of change management and leadership, but really how can we help foster and supporting that learning between countries who have great examples of leaderships or have lessons of what's been tried, what they've learned, what really needs more focus, and what tools can we help provide to identify incremental changes within these supply chains towards the long-term vision, towards the future vision, and help them form powerful coalitions to do that. So our question as the conveners yesterday is, how can we help our supply chain leaders and champions articulate and implement this vision for the future? There's really great demand. It surpassed our expectations and a little bit terrified us because we had over 100 participants there. We started out thinking maybe 30 or 40. So representing 14 different country governments and their partners or representatives, implementing agencies, NGOs, academia, international organizations, donors. And here's at least a partial list of the countries that were present in the room and represented.
So essentially the objectives of yesterday was really to have a conversation around leadership. We've been working on some of these initiatives for a couple of months now, and we really are still discussing and defining where we need to be and what we need to do to move this forward in countries. So the objectives, the question was, what does it mean to be an effective supply chain leader was one of the key questions. So for the day, we were looking to define leadership, what it means to be a good leader in general, and how this applies to the supply chain. What qualities are then required to make an effective supply chain leader? We want to look at a competency set. So having defined what the qualities are, what are the competencies that this sort of individual will need, and what are some of the gaps that currently exist within our various systems. It was very much a sharing experience. I mean, I think that was the most powerful part of one of the most powerful parts of the day, actually, was the sharing from the countries. So we had 4 countries representing their experiences, which Bridget will go into more detail on later. We wanted to share some guidance. I mean, we've been doing some thinking around this over the past couple of months. Some models are starting to come out. Some guidance has come out. There's obviously a lot of guidance already from people that deliver. So we wanted to share this, to disseminate it, to make sure that it is available for those who wish to apply it and move their initiatives forward in country. And then we didn't want the day to end there, the conference to end this week. We had a little activity around developing some action plans. So what do we need to do next? When we get back home, what are the steps we're going to take to move this initiative forward? And there was also an opportunity to meet those who are available to support these initiatives and continue that conversation with you. By the end of the day, I mean, just by looking around and seeing that everybody came back today, and we didn't totally put everyone off the conference, I think we achieved the expected outcomes. I think we had a good discussion on the agenda, a general understanding of what is required for effective supply chain leadership. We went into some of the competencies, and I think there's a good alignment in terms of the competencies required. And we also recognize that the role of the enabling environment, that this doesn't happen in isolation, and really there's a lot of factors in the enabling environment that need to be taken into consideration with these initiatives. It was very much a south-to-south exchange and ongoing initiatives, and I hope even within, during the coffee breaks and outside the room, there was that sharing of experiences, and I hope that continues throughout the week. We shared some of the guidance, some of the models that are already there, and obviously welcome the critique and your insight into how those models can be strengthened. And then we all came away with some action plans, at least by country. There were some action plans, and obviously we'll follow up on those and make sure that everyone is getting the required support. And there were many implementing partners in the room who are available to support, to give that technical assistance. Pretty much related, linked to the objectives. So the agenda covered some of the general definitions of leadership, the validation of leadership competencies. We had this dialogue with the countries that we were honored to, we're happy to share their experiences. So Ethiopia spoke, we had Liberia, very much within the Ebola context, which was very relevant, and then Namibia and Nigeria. And then there was a sharing also on current initiatives and opportunities. So this whole thing was brought together by some of the ongoing initiatives, by people that deliver, obviously, by Gavi and by USA Deliver. So there was a sharing on what the thinking is around those initiatives and how we're looking to take those forward and to use them to support, ultimately to support supply chain strengthening, supply chain transformation within countries. And then we had this brainstorming and planning. This was the afternoon session where the action plans came about. So there was a readiness assessment. Are we ready to move forward on this? If we're not ready, why not? And what can we do to get to the point where we are ready to do something around supply chain leadership? Identifying stakeholders, very key. As I mentioned earlier, this can't happen in isolation. So who are the key stakeholders within our various settings that we need to identify, that we need to influence, that we can support to advocate with? And then what are the support and resource needs? It's all good and well defining strategies and giving you all these models, but how can we support? How can we all support to operationalize these initiatives and make them happen in country? I'll hand over to Bridget to speak a bit about the country experiences.
So I'm really just the humble messenger for these. We've done our best in one slide to capture these really dynamic and powerful presentations. So the presenters are here at the conference, and I would just say that if you've got more questions about these, we're probably not the ones qualified to really elaborate, but please find them. And so we've put the contacts at the bottom of each slide so you know who to talk to moving forward. So the example from Ethiopia was pretty inspirational. It's really a story of this huge transformation in less than 10 years. The creation of the Pharmaceutical Fund and Supply Agency in Ethiopia that was done from the offset with a really clear forward-looking vision and this master plan and these metrics of successes. The statement that was made that I really took to heart was having Mr. Tadasi stand up and say, we know where we're going, we have a master plan, and we know how we're doing because we have KPIs, which I just thought was a really powerful leadership statement. And so it starts with these very high-level system changes, but through a realistic iterative process and real investment and understanding of the importance of the capacity building of the human capital to execute this. The partnership and strategic alliances really needed to make it possible, and then leveraging available technology, tools, and expertise. It wasn't an isolated initiative or action within a vacuum, but really reaching out and bringing others in to make this happen. And it's really incredible what they've achieved just since 2007. So Liberia was a different perspective, and unfortunately, we didn't have our representatives here from Liberia because obviously the Ebola crisis has really struck. But I'm going to be quick on this, but essentially their example is about what they're going through right now and how they've really brought in high-level stakeholders, the president's office, other ministries, to develop this coordinated Ebola response platform and the recognition of the importance of the supply chain for its success, and because of that, this joint coordination of the supply chain management unit across all of these high-level partners. And Lloyd Matawi from Pharmaceutical Systems Africa is the one who developed the presentation and who you could contact about further information, although I might wait till he's less busy with Ebola response. Namibia, and I will defer any question on this to Lazarus Ndongo, who is sitting right here from the Ministry of Health and Social Services and the tertiary medical, I'm not even going to get your officer, I'm not going to say it. Lazarus can tell you. But they're in the process right now of repositioning their supply chain, developing 2 directorates, one for pharmaceutical services, one for supply chain management, and linking that with the Medicines Regulatory Council, so really elevating the position of the supply chain in country. And in Nigeria, they shared really perspectives on what makes an effective supply chain leader, and they referred to this as this transformative journey, which was spurred by data, an assessment of where they stood in 2010, and a realization that there is a need not just for improvement, but transformative change. And I love that they talked about this as a journey. So they identified quick wins, strategic improvements, championed the supply chain, identified and invested in leadership qualities, and recognized that from the outset that leadership was needed for this journey. And Dr. Mahmoud Mustafa, who's right there, can tell you much more about what they're doing in Nigeria.
So this whole workshop idea was a bringing together of a number of initiatives, one of them being the Gavi supply chain manager. A year ago, a number of members of the Gavi Alliance came together to pull together an immunization supply chain strategy. So there was WHO, UNICEF, the Gates Foundation, and of course the Gavi Secretariat. The strategy had a number of, was approved in June by the Gavi board, so is now moving into the implementation phase. And it has 4 building blocks: people, data, equipment, cold chain equipment being immunization, distribution and transport, and then it has a cross-cutting theme, which is around supply chain system design. Out of the people building block was identified the fundamental. Before any of these initiatives can really move forward, we need somebody to lead the initiatives in country. So establishing or reinforcing the post or the role of the supply chain manager, the supply chain leader in country was seen to be one of the fundamentals that had to be put in place right from the start. So UNICEF are leading that initiative on behalf of the Alliance, and really it is around how we can drive the leadership agenda forward, how we can provide countries with the technical assistance, supporting the planning, in the identifying of competencies, how we can support in identifying what needs to happen within the enabling environment as well, how we can support in linking up with ongoing opportunities, and obviously, it all boils down to how we can also support with mobilizing resources from donors to drive things forward.
Okay, so we're going to wrap up. I'm just going to quickly talk about the leadership initiative for supply chain that USAID and Deliver have been bringing together, but blink and you'll miss it because we don't have a lot of time. So we've got this framework that is helping support leaders to achieve commodity availability in their country through changing their supply chain institutions by empowering the individuals who work in them. And the framework of how they can do that, the change management model, is this innovate, do, review model that we've borrowed from John Cotter. And so briefly, if there are 8 steps to change management and a process of skills development, and like we mentioned before, coalition building, mentoring, virtual mastermind groups for the leaders who are engaged in this. We're starting with India. We're linking with Gavi to look at that in some of the countries where they're implementing their people and practices strategy, and engaging other donors to help us support that, and spent much of the afternoon with those 14 countries present thinking about what this model could do for them and how we could help bring it to them. And just lastly, in closing, I think it's really important to recognize the people that deliver role in all of this, and really the leadership of the executive manager, Andrew Brown, who helped bring UNICEF and USAID and Gavi together about this. So, thank you.
Amazing. And another clap, because that was a whole day's work in 20 minutes, and they've captured everything because I was there and I listened to that, really. Again, you're a testimony to that. Yeah, thank you very much. Rebecca.